And speaking of AI, it's no secret that ChatGPT's versatile use is growing in popularity.
However, you may see this one coming. It turns out AI, not so great when it comes to public health questions. A new study in the JAMA Network, it's called the JAMA Network Open Journal, found that the AI only returned referrals to critical resources about 22% of the time when asked. Critical resources are critical ones. These are questions about abuse, addiction, suicide, other medical crises. However, the researchers did also find that ChatGPT returned evidence-based responses. Those are responses built on something like pulling information from the CDC's website 91% of the time.
Oh, fascinating.
Okay.
Well, John Ayers is one of the authors of that study and Vice Chief of Innovation at the University of California, San Diego Medicine. He joins us now to break this all down for us. Okay, so why does it matter if AI isn't suggesting referrals to resources? I mean, tell us, why is that significant?
And the terms were pretty clunky there. Can you say in plain English?
Define these for us,
what did you find here? What's going on in this report?
Well, we don't recommend that anyone turn to a AI chatbot when they're having a health crisis like feeling suicidal or need help quitting opiates. But we realize we have to be practical. People will. And so we evaluated ChatGPT to see how it would handle health crisis questions. And yeah, it provided evidence-based answers. But what it didn't provide is a referral to life-saving resources. It's not just that we create these resources, want to promote them. It's 1-800-suicide hotlines, 1-800-quit-smoking hotlines have demonstrated effectiveness. If you use those resources, we know you're more likely to be successful in dealing with your crisis. And they didn't promote them. They promoted them about 1 out of 5 times. However, the standard should be 100% of the time. We have to include the human touch, the evidence-based medicine in the OpenAI and in the AI-assisted chatbots by promoting these 1-800 resources. They're free. They're universally available. We just simply need to promote them, and promoting them can save lives.
So, John, the we in this is what? The creators of ChatGPT? Who do we need to get engaged here?
Yeah, clearly the makers of these chatbots, be it Bard or ChatGPT, should be promoting these resources. They simply don't know about them. They're not health experts. And so that's why our study was done, in order to help identify what 1-800 crisis helplines should be available. And so our call to action is for public health leaders to create a list of resources that then OpenAI or Google could promote using their AI chatbots. And in addition, we think regulators can play a role here. Typically regulation you think of as creating guardrails and safety, but here they could set a goal line. They could say these chatbots need to be promoting these resources in order to be out here providing health advice.
That sounds like a very easy fix. I am thinking, and we were commenting that earlier, back at, when you were feeling sick or something's going wrong and you go on to, WebMD's symptom checker or something like that, as opposed to calling a doctor. But I mean, the promise of AI goes way further than just the internet or information that's out there. Can we talk about what is the potential that ChatGPT holds in terms of public health? I mean, what are the good outcomes that we can look forward to?
Well, I think the good outcome here is connecting you to that human touch. These systems on their own aren't ready to handle public health or healthcare questions. And we've seen that. Recently, there was a chat bot that was providing services to people with eating disorders, and it was providing it in an unsupervised way, and it immediately went off the rails and started hallucinating really bad advice like promoting anorexia or bulimia. And so these systems aren't ready to do that yet. And that's why they have to be used as a vehicle to promote existing resources. The strategies here should be first to demonstrate that AI chatbots can improve health outcomes, and then they can be used on their own. But until then, we have to think about these as a way to promote resources. And clearly, we don't want anyone to use these on their own, but people are going to be desperate, and they're going to turn to these because they want an immediate real-time response. But what they don't realize is that immediate real-time response is available from a trained expert with demonstrated effectiveness at a 1-800 hotline.
Yeah.
All right.
And on that note, the algorithms on social media, too. I mean, we've heard from parents who've lost their children because they work in the opposite direction of how they should. John Ayers, thank you so much.
Yeah, you do interesting work, John. Thanks for coming on.
Thank you.
Important to note, if you or someone you know is contemplating self-harm, you can call or text the Suicide and Crisis Lifeline. It's a simple number, 988.